Ladies and gentlemen, please welcome Dr. John Torres of NBC News and Dr. Vivek Murthy, Surgeon General of the United States.
Well, thank you very much, Vivek. Thank you for being here with us. Again, Dr. Murthy, the Surgeon General of the United States. And we want to talk about mental health in the context of what's happening, kind of looking at what's been happening over the last few years especially, and kind of the global context as well. So thanks you for being here with us. I know this is a big emphasis of yours and has been for some time. Where are we right now? What's the scope of the issue? What's the problem?
Well, I'm glad you asked, John, because this is an issue that has been made worse by the pandemic, our mental health struggles, but that also preceded the pandemic. And it's been a problem for a long time. You know, for me, I think of this both as a public health issue, but also I think of it from the standpoint of a doctor and just as an individual who has also struggled myself with the mental health challenges during my lifetime. But a lot of people who struggle in the shadows. And I worry in particular about our kids because the youth mental health crisis in America is really profound. And there are three numbers that I think of in my head to remind me of how profound it is. One is the number 57. That's a % increase in the suicide rate that we had among young people in the decade prior to the pandemic. The second number is 44%. That's as of last year, the percentage of high school students who say they feel persistently sad or hopeless. That's nearly half of high school students. So at a time where we believe, you should be looking forward to the rest of your life, opportunity should be opening up, they are feeling sad and hopeless. And the other number is 11. That's a number of years on average it takes from when a child has symptoms of mental health struggles to when they actually get professional help. 11 years, that's an extraordinarily long and unacceptably long time. So if we look at that data, I extrapolate it to the stories of young people that I hear all across our country. These stories tell us that our young people are struggling and that they are in crisis. And there are a lot of reasons for this. The pandemic often gets pointed to, and that has certainly been an extraordinary stressor. But even before the pandemic, young people were growing up with technology, particularly social media, that helped them in some ways to forge some connections, but also led many kids to experience cyberbullying that led to an erosion of their own self-esteem because there was this hyped up culture of comparison online and made them in some ways feel worse about their friendships. Kids will also be dealing with bullying in person. They were dealing with the lack of access to help. And you think when I talk to young people all around the country, they tell me, they say, hey, you older generations want us to think optimistically about the future, but we're facing down climate change and not enough is being done about it. We're dealing with racism. We're looking at the threat of violence in our communities and seeing it plastered across the papers every day. Like, are you sure the future is better? You put all of this together, along with the stressors of the pandemic, and you can understand why our kids, are in a tough spot. So this to me is one of the most important public health issues that we have to address. It's why I issued an advisory on this topic last December, and where we're going to keep working on increasing access to care for kids around this country.
Speaking of kids, and not to completely focus on that, but one of the things I was just thinking of when you and I were growing up, and when most of us were growing up, if there was something at school like a bully or something like that, and we were being affected by that, or there was some social faux pas we had at school, that lasted during school hours. You went home and you didn't really have to focus on that. It's not like that these days because there's the social media, there's all these other things, and we still don't know where to point fingers for any of these things, but are they having a tougher time now than we had, or is it just across the spectrum throughout the years and we're just focusing a bit more on it now?
It's a good question because I think every generation will say, historically will say, well, look, we had it tough too, right?
Even walked in snow 3 miles to get to school.
Exactly, uphill both ways, you know how it goes. And while there are a lot of the typical challenges of growing up that kids still face today, trying to deal with your own developing identity, trying to figure out how to grapple with relationships, challenges at home, et cetera, there's something uniquely, I think, difficult and challenging about growing up today. And I think some of it has to do with exactly what you mentioned, John, the challenge of technology, making, one, embarrassing moments ubiquitous, making bullying something that also pervades all parts of a kid's life, especially cyberbullying. But I think the challenge also of technology is that in its best moments, tech can be used to help strengthen our connection, help us find community. But the way many young people are using it today, the way they describe it to me when I travel around the country, is they say it's actually making them feel worse about their friendships. It's also making them feel worse about themselves. Like people have compared themselves to each other for thousands of years. But the culture of comparison is so intensified, in an online environment And it's also distorted. Like a lot of times what you see online is not real. But when even if you know that intellectually, if you're a young person whose identity is developing, whose emotions are developing, you're seeing constantly people and images and messages that tell you you're not good looking enough, you're not famous enough, you're not smart enough, you're just not good enough, that starts to impact you. So I think you put all this together and you see a very different environment for kids with a relentless barrage of information and messages, many of which make them feel worse about themselves and about their friendships.
And you brought up that the pandemic, this all occurred prior to the pandemic, and this has been an issue that's been going on for years. Did the pandemic worsen that or just bring more attention to it, all the issues we're talking about with mental health going on right now?
So I think the pandemic has certainly worsened things for a number of kids. Look, there are, I think, a smaller number of kids who have actually thrived during the pandemic, but for many children, especially kids who come from communities that have traditionally been marginalized, who may come from families that don't have a lot of resources, they were dealing with a lot of stressors at home during the pandemic. Maybe their parents lost jobs or are at threat of losing their jobs. Many families were struggling with food insecurity, and they relied, in fact, on school as a place to get free or reduced lunches. When kids were not in school in 2020, that was a real challenge. And so that's why one of the things that I'm, feel so glad about is that we have our kids back in school in person. That was a big priority for President Biden when he came in, get our kids back to school, create the environment where people can get back to work safely. And thankfully, we've been able to do that in the vast, vast majority of school districts across America.
So now, prior to coming out here, you and I were talking about a difference that's occurred over the last few years, maybe 10 years or so, whereas before, people were very hesitant to talk about any mental health issues they might have. If they did it, they were doing it kind of behind closed doors, and they weren't telling their friends or their families that I'm going to see a counselor, that I'm having issues, struggling, I need some help with this. That has changed a little bit to the point now where, and I know some of the work I deal with and some of the people I deal with are very open about it, and it's very accepted among the populations that I'm dealing with. Has that been a change, or is that something I'm misperceiving?
No, I do think there's been a real shift in the stigma and around mental health. I think, and a lot of this, frankly, is being driven by young people who have said, we need to think differently about mental health, and who are speaking more openly about their own struggles.
And we've seen celebrities coming
Yes.
out saying, I'm having my own issues.
We certainly have as well. And I think the broader message that we have to convey here is that mental health is health. It's part of our overall health and well-being. It's no less important than our physical health. But I think, John, even going back to when you and I were in medical school, for example, I remember mental health just did not receive the kind of attention in medical training that the rest of our health deserved. So that's starting to shift. But if we want to address the mental health crisis, I think there are three big things we still have to do. The first is in the category of changing and shifting our belief, because still for many people, mental health is something that they're ashamed of and don't want to talk about. I think the second thing is we have to make access to treatment just much more available. So many people, kids and adults, are having to wait months and months and months to see a provider. Many insurance plans do not adequately cover mental health services, either reimburse for them or have providers in their network. And so we've got to make care more accessible, and that means building a stronger workforce and a diverse workforce of mental health providers, but also making sure that we use technology to bring care to where people are. But the third is we have to invest in prevention. The good news, John, is we have programs that we know, when instituted in schools and in communities, do work to lower the chances that our kids may struggle with mental health issues down the line. Yet we're not implementing them, and some of that is awareness, some of that is lack of funding, some of that is lack of technical expertise. But on all three fronts, prevention, treatment, and stigma, we have to act. And we already are seeing progress. Under the Biden administration, there's been a big push to get real dollars out to address these issues. Billions of dollars in the American Rescue Plan, more money in the president's budget to expand access to treatment, to invest in the mental health workforce. We've got to continue and accelerate that momentum, because a lot of people are struggling right now.
And talking about how to fix it and kind of focusing on that for a minute is, I know one of the issues is, mental health, healthcare professionals. There seems to be a limited number of them, and there don't seem to be a lot coming through the pipeline. And so there seems to be an overwhelming number of people that need help versus people that can give them help. And when you talk about treatment, you're not talking about medication necessarily. Medication, therapy, talk therapy, those types of things, I'm assuming. Where do we go from there? How do we fix that part of it?
So it's a really good question, and you're right. When we talk about getting people help, it's not only medication, which is the appropriate treatment for some people.
Right, exactly.
For many people, though, even whether you're taking medication or not, having somebody that you can speak to, a mental health professional, a counselor, is incredibly important. We have to think more broadly about the workforce, though. It's not just psychiatrists who make up the mental health workforce. We need to bring counselors into schools. We need to train community members in mental health first aid, and we have to recognize the extraordinary power of peer counseling programs, which I've had the privilege of witnessing and visiting across the country. And they're extraordinary, and they're very, very powerful when it comes to getting help, especially to young people, that when they may be struggling without access to a traditional mental health provider. So these are all places where we have to act. And the good news is, again, some of the funds already, in the last year and a half have gone billions of dollars of funds towards supporting more counselors in schools, training more mental health providers. But I just want to emphasize the technology piece as well, because it's not just about how many health providers you have, it's also about where they are, right? If I have got, let's say, an excess of mental health providers in city A, but in a small town, 500 miles away, I've got nobody, then that doesn't solve the problem. This is where technology comes in. One of the silver linings of the pandemic was that it accelerated the use of telemedicine, of using technology to bring remote care to people. But what we have to do now is extend the telemedicine authorities, invest in ensuring people have the broadband access, which thankfully the infrastructure bill will help to do, but make sure that we use that technology to bring care to folks in remote locations, to bring care to people in urban settings where there aren't enough in-person providers. So we can actually address this crisis, John. I feel like we know how to. That's the good news. And we have, as you and I were talking about a little earlier today, we have an alignment, interestingly, of forces that I have never seen before in my time in public health to actually address the mental health crisis. We have bipartisan interest in Congress in moving real legislation forward. We have community members across the country who are paying attention and interested in this, educators and doctors and nurses who want to be a part of the solution. Certainly President Biden has made it his, one of his signature, priorities. We have a lot of initiatives on a bipartisan basis that are aligned, but these windows don't stay open forever. And that's why I feel a great sense of urgency around this issue. It's why I'm dedicating my time, as Surgeon General to addressing the broader mental health crisis that we have in our country, because it's just, we cannot wait any longer to get to solutions.
And arguably, 1/8 or 1/3 of our day is taken up by workplace environments where we're at work during the day, usually 8 hours or so. Is there any place for the workforce, where you work, to come in trying to help this get under control?
Absolutely, and this is where part of thinking differently about mental health is not just saying, okay, how can we build more hospitals and community health centers? That's an important part of it. But it's also about saying, how can we bring care to where people are? And to your point, schools and workplaces, these are places where people spend and children spend an extraordinary amount of time. Just take workplaces as an example. We know that workplaces can play a powerful role in helping to shape the culture around mental health, like how leaders in the workplace talk about mental health, the spaces they create to get, encourage people to get access to care and help. Yeah, it makes a big difference. Coverage is another area, right? We know that providing strong insurance plans that include mental health coverage is also, important. We know that thinking about the employee assistance programs you have and how those can help support people with their mental health and well-being is also critical. And one last thing people shouldn't forget, which is that in the workplace, how connected people feel to each other is a powerful determinant of their mental health and well-being as well. And all of this has a profound impact on the outcomes, the bottom line outcomes that workplaces care about. It turns out, not surprisingly, that when people are doing well in terms of their mental health, when they're feeling deeply connected to other people in the workplace, they tend to be more productive, more creative, they're more likely to stay in an organization. So both for the sake of doing well by individuals, by your workers, as well as doing well by your business, it makes sense to invest in mental health. And workplaces can make a huge impact here. And it's one of the reasons why we are, in my office, we're working on an initiative around workplace well-being, that we'll be releasing soon, to lay out a roadmap for what workplaces can do to become engines for mental health and well-being.
And just to show you how cool I am, I think the person was Billie Eilish. Surprised I even know who that is. But she had commercials where in the commercials she would say, it was the public service announcements, that it's okay to ask somebody if they're doing okay. Right. In other words, and that's part of the workplace environment too. Of, we have it on a corporate level, we have it on a work level, we have it on a professional level, but on a personal level, are we doing anything to broach that, to say, hey, it's okay as a person to go ahead and ask somebody else if they're doing okay?
That's right, it absolutely is. And you never know when asking that question, or starting that conversation, can make a profound difference in someone's life. What you're saying to somebody when you ask them how they're doing, when you genuinely wait to hear the response, is you're telling them that they matter. You're saying, I see you, you have value. And there are so many people who are walking around our country today, around the world today, who feel like they don't matter, who feel invisible and who feel like they're struggling but nobody cares. And you can convey so much simply by pausing to ask someone how they're doing. You can't rely on how people look on the outside. You know, we're all almost professionals in masking like how we're actually doing. And it's partly because of the cultures many of us, grew up in. But I'll tell you that there are, and I know this because people often share their stories with me, privately after talks or this or that. Some of the people who you think have it all together in their life, they seem to be super successful at work. They're the kids who are like excelling in college or in grade school. They're famous, they're rich, they're powerful, they've got fancy titles. You think they've got it all, but many of them are profoundly unhappy inside. And so, just pause, take that moment to check in on one another. It's one of the most powerful things that we can do.
And often we talk about mental health concerns we have here in the United States. This is a global issue. And as I frequently say on air, this is a small world. And so things in other parts of the world can affect us and vice versa. Do we need to look at it from that context?
We absolutely do. And it turns out that this is one of the elements, I think, of our lived experience that reminds us of our common humanity. That people all around the world are struggling in terms of their mental health. And I say this because when we talk to leaders of other countries, people who lead public health efforts in other countries, they speak to the rising challenge around mental health. And there are some common factors that we're dealing with: strife, the impact of certain types of technology, social media in particular. But look, it's tough right now. If you're reading the news, if you're following stuff online, it's easy to feel burdened by everything that's happening in the world. It's not always easy to find a source of hope. So this is a global issue. And I do think that when we think about it in that context, it makes sense to make mental health a global public health priority. We should be coming together as countries across the globe to share experiences, best practices, research, to actually help one another get better at providing treatment, but also at investing in the kind of prevention that ultimately we know is so important, especially given how many people are struggling.
And particularly, I think that best practices is an important thing to highlight, because there's other places that are doing things better than we are. We are doing things better than they are in certain areas, so sharing that information, I think, is a good step forward. Mm-hmm. But one of the things you focus on a lot is community and connections, what you call social connections and loneliness. Mm-hmm. Explain that.
Sure. So one of the things that struck me, John, when I was Surgeon General during the Obama administration was I was traveling around the country trying to understand how I could be helpful when I first began the job. And I was hearing a lot of stories you would expect, people who were struggling with chronic illness, people who were worried about violence in their communities. But I started hearing more and more stories from people who were struggling with loneliness. They used different words to talk about it. They didn't always say lonely. But it was very clear that they felt invisible. They felt like they had to carry all the burdens in their life alone. And they just didn't feel like there was anyone who had their back. And this felt very familiar to me, because as a doctor, I had seen this very much in my patients, right? Not something I learned about in medical school, but certainly something that patient after patient I came to see was really struggling with a sense of real isolation, loneliness. But I'd experienced this as a child as well, and at various points during adulthood. And what I came to realize as I dug into the research around this was, number one, loneliness is extraordinarily common. There are more adults in the United States who struggle with loneliness than who have diabetes. But it's also very consequential that loneliness is associated with an increased risk, not only of anxiety and depression, but also of heart disease, premature death, sleep disturbances, and other physical illnesses. So this is why I think actually addressing the loneliness crisis in the United States and around the world, and this is a global issue, is so important, because it impacts not only our physical and mental health. It turns out loneliness impacts how our kids do in school, how people perform in the workplace, and how people engage, I believe, in society. And this is where I think more broadly, John, as we think about the mental health crisis and what we need to do, yes, it's about policies, yes, it's about programs, but it's also about culture. And the thing I find myself thinking about, especially, this morning I said goodbye to my 6-year-old, my 4-year-old before I got on a train and came up here to New York City. And they are my most important inspiration in the work that I do. But I think about the world that I want for them, the world that I want for all of our children. And it's a world that depends, again, not only on having good programs and policies to support mental health, but having a culture that promotes kindness, a culture that promotes connection, and a culture that promotes mutual care, where we recognize that we have to and should care about each other because our outcomes and destinies are truly intertwined, and that we are better off when we are both actually better off. And looking out for ourselves alone does not get us nearly as far or generate as much happiness in our life. So building that culture of kindness, connection, and concern, that is what we are called upon to do. And you don't need a medical degree to do that. You don't have to be an expert in public health. each of us in our own lives can look for opportunities to promote kindness in the workplace that we operate in the relationships that we enjoy, and through the issues that we choose to raise our voice about in the public square. So that's the call that I think about most often. That's the request I have of everyone who's listening here today, is to think, how do we build that culture of kindness, connection, and concern? It's what our kids need us to do to build a world that's truly worthy and hospitable for them in the years to come.
So a big step in the right direction.
Yes, absolutely.
Vivek, thank you very much. We could talk for hours on this one, but thank you very much, Vivek Murthy, Surgeon General. Great topic. Thank you.
Thank you. Thanks, everybody.